Good afternoon, everyone, and I welcome the representatives from the Ministry of Social Development and Family Services. And this meeting is to examine delivery of projects and programs by the Ministry of Social Development and Family Services. I will now invite the Permanent Secretary from the Ministry of Social Development and Family Services to introduce herself and the members of her team, and then I'll invite the members of the committee to introduce themselves to the members of the public.
Thank you, Chair. I'm Jacinta Bailey-Sobers, and I'm one of the permanent secretaries in the Ministry of Social Development and Family Services, and perhaps we could start from this side with the other members.
Chair, good afternoon. My name is Vijay Gangapasad, Acting Deputy Permanent Secretary.
Good afternoon, Madam Chair and members of the committee. My name is June Bell, and I'm an Acting Deputy Permanent Secretary in the Ministry of Social Development and Family Services.
Good afternoon, Chair and members of the committee. I am Sheila Citran, Acting Permanent Secretary.
Good afternoon, Chair and members of the committee. I am Paul Kane, Director, Information Technology.
Good afternoon, Chair, members of the committee. I am Carla McKee, Auditor 2.
I might ask the members of the committee, starting with my immediate right, to introduce themselves.
Good afternoon. I am Ayana Webster-Roy, member.
Good afternoon. I'm Lakram Bodo, Vice Chairman.
Good afternoon and welcome. I am Amrita Deonarain, member.
Good afternoon. I'm General Antwine, member.
Thank you. And the committee is ably assisted this afternoon by Ms. Kiba Jacob, its secretary, Ms. Sharon Samuel, its assistant secretary, and Ms. Shaki Alexis, its graduate assistant. The Committee on Public Administration and Appropriations has the mandate to consider and report to the House on the budgetary expenditure of government agencies to ensure that expenditure is embarked upon in accordance with parliamentary approval. The budgetary expenditure of government agencies as it occurs and keeps Parliament informed of how the budget allocation is being implemented, and the administration of government agencies to determine hindrances to their efficiency and to make recommendations to the government for improvement of public administration. The purpose of this meeting is to examine the delivery of projects and programs by the Ministry of Social Development and Family Services. The committee is desirous of hearing from ministry officials to discover the challenges being faced and determine possible solutions to these challenges. The role of the committee is to assist the ministry in achieving the efficient delivery of services while ensuring that expenditure is embarked upon in accordance with parliamentary approval. This meeting is being held in public and is being broadcast live on Parliament's Channel 11 and Radio 105.5 FM and the Parliament's YouTube channel, ParlView. And I therefore, at this stage, will want to invite the Permanent Secretary to make an opening statement, if she so pleases.
Thank you again, Chair. And good afternoon to members and those tuned into the hearing. The Ministry welcomes this opportunity to provide information on its operations and to bring clarity where necessary. The Ministry of Social Development and Family Services has as its key responsibility the provision and maintenance of a robust social safety net for the population. The Ministry is also charged with attaining the social development objectives of government and provides leadership and direction for the social sector by focusing on research, policy making, planning, and to some extent, assessment and monitoring and evaluation. The Ministry's mission is to enhance the quality of life of the general population with emphasis on the vulnerable through a network of integrated, accessible social services. In alignment with Vision 2030, the Ministry focuses on 4 key areas as it relates to its strategic objectives. These are promoting resilience for all, protecting, empowering, and transforming families, reducing and preventing poverty, vulnerability, and inequality, and ensuring a modern, client-centered, high-performance organization. The ministry provides a suite of 21 grants to vulnerable persons on an annual basis and operates 6 social programs as well as provides 7 types of social services. On average, the ministry receives an annual budget of about $5 billion to implement its mandate. On a monthly basis, approximately 170,000 persons are provided with social grants through our major transfers. This would be the senior citizen pension, the disability and public assistance grants, and the food card at an approximate cost of $404.2 million. That's on a monthly basis, the expenditure. When one considers the average household size according to the last population census of 3.1 persons in a household, one can conclude that on a monthly basis, the ministry impacts more than 527,000 citizens, almost 40.5% of the population. Accordingly, the ministry is keenly aware of its significance to the overall stability and development of the country. The ministry also has responsibility for promoting NGO-government relationships and provides annual subventions to more than 25 NGOs, which provide social services to various groups of vulnerable persons. In fiscal 2019, approximately $41 million was expended in the provision of subventions to NGOs, including the statutory boards under the ministry's purview. In order to achieve these objectives, Madam Chair, the ministry functions through the work of 25 divisions and units, 11 are service delivery, 9 support, and 5 policy-type divisions. As at March 2020, of the 380 established public service positions, there were 180 vacant and 200 were filled. And of the 655 contract positions, we had 159 filled, and we supplemented with 125 persons on a short-term basis. So we have around 484, close to 500 persons on board in the ministry, providing the necessary support for what we do. We do also have some valuable OJTs on staff that we are happy to have, and associate professionals from the Ministry of Education. But despite operating below the optimal staff complement, Chair, the ministry has been able to carry out its mandate and provide quality social services to the people of Trinidad and Tobago. The ministry, in delivering its mandate, has identified some specific target populations. These groups include persons and families living in poverty, the indigent, persons with disabilities, senior citizens, persons living with HIV/AIDS, victims of domestic violence, violent crime, human trafficking, substance abusers, street dwellers, and the homeless, because there are some homeless persons not on the street, ex-prisoners, deportees, displaced youth, persons who experience situations of disaster, and single parents. So these are our key target groups. In terms of challenges, I think we would speak to some of that as we discuss with the committee this evening, but of course we have issues of human resources that are inadequate, the lack of structured data collection and mining, outdated data on poverty, limited impact assessment of programs and risk management, a siloed approach to delivery of our services, and a lack of a robust customer service management system. So we are taking action on some of these areas, and I'm sure we will share some of that with you. But to say the ministry is certainly committed, Chair, to the attainment of its mandate, and will continue to improve and create value through evidence-based project program implementation, and also improving on our monitoring and evaluation framework. The ministry looks forward to the discussions this afternoon with the committee and to the opportunity to share and to receive recommendations also from you. Thanks so much.
Thank you very much, Madam PS. And I would want to start off the conversation with your submission regarding your strategic plan. And I had observed that Goal 4 of your strategic plan refers to the achievement of a modern, client-centered organization. And to achieve that, one of the aspects you're looking at is, improving your administrative systems, particularly through the benefits of information technology. So I'd seen that you'd spoken about an initiative called the Social Services Client Management System, which you intend to introduce, and I want to know if you could expand on that a bit and let us know where you will have reached with that.
Sure. So I will speak to the client management system, but one of the critical systems we are putting in place is the integrated social enterprise management system, and I will ask the ICT director just to speak to that system, which we will actually be negotiating next week with respect to the supplier, and so he will explain how it would work. Mr. Kane?
Good afternoon.
Afternoon.
So the social enterprise management system, fondly called ISIM, is an enterprise resource planning system that will be implemented throughout the ministry, and it will also have a facing to our clients. So the both set of customers will be internal customers and external customers. The aim of the system is really to automate the work that is currently done by our manual system, and we have a partial automated system, an in-house built system, which is the Social Services Client Management System. So that was built in-house. So the ISIM will incorporate both the manual and that aspect of the automation that we built. It's planned to be an end-to-end in terms of it will incorporate all the work done by the ministry from intake interviews to actual the processing of grants and the payments of grants.
And could you just remind me when you expect that this system will be fully integrated?
We have a timeline of 9 months. As the PS noted, we're going to start negotiations next week with the vendors, and we're hoping that we will take about a month to finalize the contracts with the vendor. So we're seeing around September, October of this year, right? Just keeping in mind the risk of the coronavirus and those things we have to keep in mind in terms of our risk assessment. But the application is not a complicated one in terms of the vendors and the experience in building similar applications. So.
Okay, so this is still a little way off.
Yes.
And that's why I had really started with what exists.
Yes, what exists.
The one that you built, which is partially automated from what
yes.
I understood from what you said.
Yeah.
If you could tell me what are the limitations, apart from it not being fully automated, what are the limitations? Because if I listen very carefully to the caveats you put there, it means one or two things. Either you will be operating your partially automated system from now till October, November. You say September, but I count 9 months from now, and
okay.
So we might be a little different in the months, but it doesn't matter. Either you'll be operating it till then, which means it carries you into the next fiscal, or having regard to the caveats, you might be operating it for an unknown time. So I wanted to get an appreciation of what it was, what the limitations are, and how it affects your service delivery.
Okay. Well, the limitations are basically resource constraints. In terms of the staffing, the development, the solution development team, we are limited in that HR actually is working in terms of trying to recruit persons, but there are some challenges sometimes in getting the type of quality of persons that you're looking for. So that is the major constraint in terms of in-house development, then to compete with the other activities that IT has to deal with. So the process of building it out and maintaining it, because once something is in production, there's a factor of maintenance of that said solution. So because of that constraint, there's a challenge in taking it from end-to-end process as what the ideal would be, right? So while we're working with it and we have some aspects of the business that fully utilize it, the challenge is to make it a single stream system so that we can incorporate all these services and have a bird's eye view of everything. And it's really a challenge in trying to put resources to get there to meet the business and the business needs.
Okay, so within this fiscal year, you would have a budgetary allocation for ISEMs. Yes, you do. I guess it may be that there have been no releases as yet because you're now going into the negotiations, or do you have releases? Not as yet.
Sure.
All right. And might I ask, what you had said is that you're also looking at interagency committees to help you achieve your national social mitigation plan. Could you identify which are these interagency committees, and how do you expect they would further your national social mitigation plan?
Thanks again, Shreya. We have two committees that were appointed by Cabinet. We have the committee that is looking at the macro level at what is necessary to ensure that the plan is implemented. And then we have the committee that is working at the programmatic level. So that committee, all the committees would have representatives from ministries, particularly the social sector, but we also do have representation from the Ministry of Finance and the Ministry of Planning, which are the central agencies with respect to the development objectives of the country. And what we do is we ensure that both committees know what they do, what they're working on. So the programmatic committee, and Mr. Ganga Prasad is actually the chair of that committee, they are working primarily on the rollout of what we call the Social Services Empowerment Unit, which is a new unit. Well, new, but we will actually be trying to ensure that what we have on board right now in the ministry is assimilated into that unit, so we don't have to go out looking for new bodies as such. So we are looking at setting up that unit, which is going to be like an integrated service delivery type of unit where all these services will be provided across the board without having to go to different locations and different units to get the service that you're looking for. That division, that particular committee is also looking at all the various programs that are identified in the social plan that in the various areas, because we have different areas of the plan, and how we can ensure that what is in the plan for those programs to improve some already existing and to bring on new ones will be implemented. The committee of which I am the chair, which is the one looking at the macro level, we are looking at, for example, how ISEMs will integrate with the rest of the social sector so that there's a seamless provision of services across the sector. So it would be those kinds of initiatives that the committee looking at the macro level would address. We are also looking at how ministries can collaborate to ensure that we meet the objectives, the national objectives of Vision 2030 as outlined in the social mitigation plan. So these are the two committees, and also we are working with a consultant, which was also approved by Cabinet, and the consultant is expected to come on board in the next 2 weeks or so, I would think, before the end of this month. to ensure also that we bring together and synergize all the elements between the two committees for the implementation of the plan. So their remit is the implementation of phase 1 of the plan, which is outlined and which is also approved, and includes a number of new programs that will come on to bridge the gap right now in the provision of services.
Okay, so let me ask something. Would a delay in SEMS, would that affect the outcome of the social empowerment unit?
It will limit it, but we would be able to do some of what is necessary with the in-house
If you have to
solution.
continue
With the in-house
the
solution.
partially
Yes.
automated system.
Yes.
Now, in terms of these interministerial committees, do you all have a timeline to achieve your mandate?
Yes, they all have timelines. So I believe the NSMP committees, it's 2 years, I believe. 2 years, yeah. We have other committees like the research, Interministerial Research Council, they are 3 years, so they all have
Timelines. But the two major ones, the one, the macro level, I guess this is the inter-agency committees, the one on the macro level and the one on the programmatic level.
2 years.
2 years. And those 2 years end when?
We started in 2019, I believe, so it will end somewhere next year.
And how regularly do you all meet?
Every month.
And every month. And do you all generate reports and
We generate minutes and
just
so on.
minutes, yes. All right.
Yeah.
So, all right. So, I wanted just to talk a bit about your tying in what you'll do with Sustainable Development Goal 1. And what we had observed is that you indicated that the poverty rate is 16.7% mean. Could you expand a bit on what that means, how you come by that, and so on?
Okay, so that would have been a 2005 figure, which is the last time we would have done the survey of living conditions, which is the survey that we depend on to tell us what the poverty line is, the vulnerability line, the food poverty line, and so on, who are the persons in poverty, and so on. And we would have done one in 2014, but you would see that that wasn't accepted. So the new SLC is actually being done this year by CSO. They are starting the fieldwork this year, expected to complete in January 2021. So the that survey usually tells us, as I indicated, what is the poverty line, where the poverty is concentrated. So it will tell us, you know, the last survey would have told us that I think it was Sangre Grande had the highest level of poverty, so it would tell us where the concentration is highest. And of course, who, as I said, are the persons in poverty, whether there's some peculiarities in terms of male, female, and so on. So those are the details that we would get in terms of the poverty report.
So how relevant is that 2005 information to today?
Well, it's outdated, so that's why it limits us in terms of our planning for poverty. So we also have a responsibility for developing a poverty strategy, and that's one of the main reasons why we haven't yet gone forward with that strategy, although we're still working on other aspects of the strategy while we are waiting on the data. However, we still have an approach that we could use where we can utilize the poverty lines and inflate it with the inflation rate so that we get a sense of what the poverty line is at, for example, 2019, and we could use that for planning. So we have done that with respect to the introduction of a standard means test, which we introduced in March 2018, using the 3 lines, the poverty line, the vulnerability, the food poverty line, and inflating it to be able to tell us, you know, what the basket of goods would costs at any point in time, whether it's 2016, which we used for the means test we introduced in 2018, and we recently revised it again up to the end of 2019 in terms of what it would cost at December 2019 for the food basket.
So you're using that 2019 figure?
We
Currently.
trust, we have proposed to move with a revision of the standard means test using those new poverty line figures.
Okay, and when is that revision likely to take place?
Once it's approved, it would most likely be from, I would think, next month, or within the next 2 months, I think, in terms of implementation.
And it's approved by whom?
It would have been proposed to cabinet.
All right, and you've sent the cabinet notes and everything already? Okay, all right, thank you very much. Member Antoine?
Good afternoon once again. In your response, you said one of the challenges faced was in managing projects, and the quality and quantity of the human resource was one of the biggest factors. You also mentioned that you had gone on a recruitment drive to fill the vacant positions. Could you bring us up to date on the progress of this recruitment drive, and when will it be completed?
Okay, so Ms. Bell, could you give a sense of what is happening with our contract positions and so on in terms of the recruitment drive?
Good afternoon. With respect to the contract employment, there are so far 814 contract positions. To date, 159 of them have been filled, and 655 are vacant. There is a breakdown of the various areas within the ministry where these contract positions have been filled, and right now HR is working assiduously to have interviews done and to get them filled. So to move forward, I don't know if you would like me to go through the different areas in the ministry.
I think you were particularly concerned with project management, that area, project management unit. Oh, the various areas. Okay, sure. We'll give a sense of some of the areas that we are giving priority.
Priority has been given to the National Family Services, the Social Welfare Division, the National Social Development Program. Those are the main areas that have been prioritized. And IT. As well as the Public Implementation Unit.
But with 655 vacancies still outstanding, how effective are these divisions in implementing the programs that really go out to the socially displaced in our society?
Let me just say that although we would have mentioned 800 or more and more contract positions, the ministry is going through a restructuring exercise. There are about 3 or 4 units that are no longer operating, so of course we wouldn't fill those positions. And also we are working with Ministry of Public Administration for that restructuring in terms of the ministry, its units, and so on. So at this point in time, too, while we are recruiting some critical areas, we are also awaiting the report from the Ministry of Public Administration with respect to the restructuring of the ministry, which was a mandate of the Cabinet for 4 ministries, including ours.
Would you be able to give us a time frame to the completion of this exercise?
The restructuring, I believe we would have the report within the next month, and it will mean a period of time for us to restructure, which probably would take, I would think, no less than 6 months for the restructuring to take place.
With contract employees, you have the fact that some of them will have become trained up. Others would have done their training a while ago, while some would have done it recently. Do you have a program in place to bring all of them on board with ethic of the Ministry of Social Development and the programs that you have in place?
Usually when we go out to recruit, when it's contract recruitment, which is in the ministry's remit, we would look for persons with the necessary skills and competencies so that we don't have to do any training. Obviously, there are some peculiarities of our ministry so that when some persons come on board, there is a period of training that must be undertaken, in particular, Social Welfare Division and National Family Services. They would have to get some training in those areas. So generally, when we recruit persons, they have to come on with the competencies, but in those areas we have training, we have orientation, and even while persons come on board and are on the job, there is some on-the-job training with supervisors who are overseeing their welfare in the field and so on. This is a little challenge for the ministry because usually when we go out, we are looking for some measure of experience and we don't always get it, so we have to take persons and train them up.
Okay, Member Bodo.
Thank you, Madam Chair. PS, if I could just take you to page 7 of your submission and look at the services for persons with disability, specifically with regards to the disability assistance grant for children, which I believe is a new grant combining 2 previous grants. Speaking with both constituents and medical colleagues, there seems to be an issue in terms of meeting the qualifications. Would you care to maybe clarify or explain how exactly the assessment is made?
Sure, I'll ask Mr. Gangapsad, who's pretty familiar with these grants, having been working in the Social Welfare Division for many years and actually is the director of that division, although he's acting DPS right now. Mr. Gangapsad?
Sure, thanks, PS Chair. Through you. This grant was actually implemented in January 2019. And the service is really a universal service. In terms of criteria, all you have to be is a child with a disability. And in terms of the assessment to determine disability, that is done by a doctor assigned by the chief medical officer for that purpose. So there is no other criteria other than the person must be under the age of 18 years. That would really hinder children at this point in time. So I am unfamiliar really with challenges being experienced in terms of meeting the criteria.
Thank you. Just to clarify, the medical practitioner must specify severe or complete disability.
Yes.
To meet the requirement.
Mm-hmm.
And is it a list of only government medical practitioners that can certify at this point in time?
Secretary, again, no, this is not like the other grants. This one has been open to private practitioners who are authorized again by the chief medical officer for that purpose. So it's not only in the public health arena, you can go to a private practitioner and get the medical completed.
And how does a practitioner qualify to be authorized by the chief medical officer?
I think that is a question that might best be posed to the chief medical officer. All we are required to do really is to get certification that the child is in fact a child with a disability. I think that there are doctors within the public health who are mainly pediatrician or pediatric specialists, and doctors in other areas who might be deemed eligible to pronounce on a matter like this. They are the ones who would fill the medical.
All right, thank you.
Member Webster Roy?
Thanks. Good afternoon again. I just wanted to follow up on Member Bodo's questioning. Learning disabilities and developmental disorders, are they considered for this program?
Yes, Chair, again, through you, yes. It is learning disability, physical, mental, they are all considered. In fact, the medical report went through a significant amount of consultation with key stakeholders. It was not really developed by us, but it was developed by the practitioners. They went through like social workers and in the ministry as well as in the Ministry of Health. And several, I do not have a copy of the medical now, but several areas were considered, including those that you indicated just now.
You mentioned severe and complete disabilities only. The reason I'm asking is the fact that a number of persons would have reached out to me in my capacity as Minister responsible for child affairs, indicating that they would have tried to access the grant. The child might have had a learning disability or a developmental disorder, and they were told that they couldn't access it. The requirements, the parameters, are those communicated clearly to your staff in your outline officers, and is the information shared with the public in terms of what different areas you consider as disability and what would constitute severe or total disability?
Chair, through you again, in terms of communication, the ministry has been aggressively pursuing that area. We have had, in the recent past, a series of education series, our PIEs, in at least in every nook and cranny of the country, if you want to put it like that. And we are continuing to do so. Currently, we are also in our outreach mode where information is provided, as well as we are also taking application. It's also on our ministry's website. And the staff, as it relates to the staff, I'm certain that they would have information. But the primary focus, which is on the medical, is really in the remit of the medical field. They are the ones who would really tell us. We would give the information as to what is required in terms of telling a person or being able to advise a person, well, hey, your disability is not so severe. We do not get involved in that. We allow the assessment to be done by the practitioners, and we are guided by what they put in that document. We do not really question what is put in the document. If a person is dissatisfied with what the medical assessment was like, they have the right to appeal the decision. So in a case like that, it goes to the chief medical officer for him to make a reassessment and determination.
So if a person receives a letter from the doctor saying that the child has a specific disability, and they come to your office, and then your staff says, well, no, would that person have, because the reason I'm bringing it up because this is the reality, this has been happening. Would that individual have the ability to appeal your decision?
The medical assessment, I'm saying this, once the medical is filled out in accordance with what is required, the staff have absolutely no right to turn an application down. So I'm not certain if you are saying that is happening, it should not be happening. And they have opportunities to go to a senior officer to ask for someone to, because the appeal of the medical goes to the chief medical officer. After that, once an application is open, if a decision is taken not to grant, then the person has recourse in the ministry where they can appeal that decision to the central board, and further to that, they could also appeal to the minister. That's the last line of appeal. But what you are describing there is someone bringing a medical, if I get you correct, properly and duly filled out, and someone is telling them no. And in my mind here, I am saying that if there are staff members who are doing that, it is improper, it is not correct, it's not correct procedure.
If I may, Chair, if they bring a report from the medical officer, and remember there are categories, so the medical officer may have indicated that it's not a complete disability, it's a lower range, then the officer may tell them, well, you will not get through because it's not complete. I think that might be the clarity, because it's only if it's complete disability or permanent that they will get it. And some of the assessments come saying, well, it's a lower range, because actually the form speaks to the different ranges. So if you come in and yours is not complete disability, the officer may very well say, well, you will not get through with the grant because the assessment doesn't say complete disability.
Just allow me. Is it complete total disability or permanent disability? Or is it total and permanent? I'm not sure what the terms are, because I think the terms are different. Okay? So what I think we're trying to find out is, must somebody be 100% disabled, and therefore there are no chances of recovery, which will make it total and permanent? Or if it's just permanent, that, okay, you have some disability, and there's no or little chance. What is the correct terminology?
So, Chair, again, in terms of the ranges, what we have on that form is mild, moderate, severe, and complete. So it must be along those continuum, mild, moderate, and each one is, the descriptor for that is based on your levels of functioning, right? So I would imagine complete might be the 100% that you are speaking about. Severe may not be the 100%. And what we are finding as well is that some conditions are coexisting. So you may have someone with a mental condition that might be mild or moderate, and a physical condition that might be mild or moderate, but when you do the assessment, the overall assessment, that is severe. So in terms of the range is mild, moderate, severe, and complete. And to answer your question, it must be severe, complete, and permanent. So the disability is one that is permanent. Yeah?
Thank you very much. Dr. Bodo.
Thank you, Madam Chair. Mr. Gangaprasad, I just wanted to clarify something that you mentioned. So you're saying that there's the opportunity for a parent, for example, to challenge a medical diagnosis through the chief medical officer. Is that what you're saying?
Chair, true, yes, that is correct. If they are dissatisfied, they notify us. We are the conduit now. We would take the report, take the medical report, and submit it to the chief medical officer, and a reassessment is done.
So the process is done through you, through your officers?
Yeah, true, yeah, they don't go back, they come through us, and we get it done for them.
Do your officers tell parents that they can do that? Are they aware that they can do that?
Yes, the officers are aware that they can do that.
And they will tell the parents?
They will tell the parents, and there is a process in place. We are trying to streamline that process right now by way of documentation, but the officers are required to tell them that, and as well as we have also notified the Ministry of Health through the practitioners who are doing it, that they can also advise the client of the right to appeal.
Yeah. Is there any intention to review the form at any time in the future? The reason I ask, I'm told the form is very complicated. I haven't seen it myself. And if I can, by way, through you, Chair, ask for a copy of the form to be sent to the committee. But have you heard that? And based on that, is it your intention to review at any point in time?
Right. So in terms of a review, we would have gotten an approval to go forward because we were trying this for quite a while. So rather than wait to get everything perfect, we did get approval to go forward so we could implement the initiative because there were people out there who were in need of it. And we were to do a review after 1 year of implementation, taking into consideration implementation challenges and issues. So yes, the answer to your question, yes, it can be reviewed. In terms of the design of the medical, as I indicated, the medical was designed in consultation with several social workers and primarily doctors who are in the field. So it can be an area based on the review that can be addressed.
You're saying there was wide stakeholder consultation in the design of the form?
Yes, we would have received comments, we would have submitted this to every one of the regional health authority and received comments from all of the regional health authority on this design and the content of the medical.
And if I may, Chair, we have received a number of recommendations from persons out there, whether it's doctors or persons in the social work area with respect to this particular grant. So in the review, we will be considering all of those recommendations.
Member Dionarine?
Good afternoon again. So, Madam PS, in the beginning, you said that on an annual basis, you all tend to spend around $5 billion on the social safety net, social protection.
That's usually our allocation.
$5 billion. Right. And also, based on an earlier question that was asked, the poverty rate that we are working with right now is 16.5%, which is based on a 2005 survey of living conditions, right? Well, I understand that there has been some challenge with respect to the 2014 survey of living conditions. Right now, based on the programs that you have and that you are executing and you're working on a daily basis, how exactly are you measuring your mandate or strategic objective of poverty reduction?
So as we indicated in our report to you, it's pretty difficult for us to do that, given the fact that we have outdated data with respect to the poverty. But within the ministry, we do try to do some assessment of the programs that we have. Not necessarily the grant programs, but the other types of programs that we have targeted our vulnerable clients. We do assessments of those programs to determine how they're working. But in terms of the poverty line, usually we could only depend on the survey of living conditions data to tell us how we are doing.
Okay, so my first question then would be, what type of assessments of these programs that you do that tend to indicate to you that it is sustainable and is also achieving the results to encourage its sustainability and continuation?
So we do have a monitoring and evaluation unit, and that unit, as I indicated, is the unit that would be responsible for doing the assessments. So we do assessments, like recently we would have done an assessment of the GAP, Geriatric Adolescent Partnership Program, in terms of the objectives of that program, whether it's meeting, and we were able to determine that certainly, and even before the assessment, we knew that we needed more caregivers for that program because the demand is so great. But the assessment would have also told us whether, it was meeting the long-term objectives in terms of the well-being of older persons and all of that, and whether, in fact, we were meeting the objectives too in terms of the caregiving and the training, because there's a training component of that program where we train up these young people to treat with the older persons, and whether it's helping them too, because usually the young people who would be in that program would be persons who are vulnerable too. They most likely would not have a full certificate, so it was also helping poverty for that cohort of young persons. So the assessment would have told us whether we are in fact bringing in those types of young people in the program, and whether even after they get the training, they are able, excuse, to get a full certificate after and move on to other types of training. Yeah.
So, now you would have said that, I want to go back to the survey of living conditions, because you said in response to the chair that in 2014, a survey of living conditions was done, but it was not approved, or something was
Yes,
wrong with
it
it. What
wasn't
was the challenge
accepted.
with?
There was some technical issues with respect to the analysis, and so that the cabinet rejected it totally and requested that a new one be undertaken. So this is why we have a new one being done right now by the CSO.
Okay. Also, no, you said that one aspect of your assessment has to do with the demand, especially in that particular case that you gave an example of. Overall, over all the social programs that currently exist in the ministry, over the past couple of years, would you say that there has been a general increase in the demand for social services in the country?
In general, there has been a demand because, well, it increases with respect to the state of the economy, and because the economy has been going through some difficult times, you would find a higher demand for social services, and we have seen that.
Which is why the survey of living conditions is so important, to ensure that we have a baseline against which we are executing these programs. I would leave that for the time being. You also mentioned that there tends to be a lack of impact assessment. So could you explain a little more about that for us, please?
Yes, so impact assessment is a little bit more a technical exercise. And in fact, having gone to STAR conference some years ago while I was in the Ministry of Planning and Development in terms of impact assessments and monitoring and evaluation, I think the technical capacity for an impact assessment, we may not really have it here. That's the truth.
Now, when you're dealing with social safety net and social programs, impact assessments are critical. We already do not have an updated poverty figure that we are working with. I know you all are working on trying to inflate the existing figures using the inflation rate. And now we are deficient in terms of our ability, our capacity to conduct impact assessments. So could you tell me what is being done to enhance the capacity of the ministry to become qualified to conduct these impact assessments?
So the remit for monitoring and evaluation in the public service is in the Ministry of Planning and Development, the transformation unit there. While I was there, as I indicated, we sought to address the issue by having a monitoring and evaluation training within the University of the West Indies to set up a department, and we didn't reach very far with that. At the point in time, financial constraints was identified as one of the main reasons why they couldn't really look at that at the point. And also, usually we would send persons to train in Canada, and even in the training in Canada, impact assessment, really, the level of training that is required, I don't think it was provided in that training. Actually, impact assessment training is very limited across the world. There are few people and a few universities that provide it. And it would require actually officers going for a lengthy period, sometimes a year or 2 years to get that training. So for now, what we have done is just simply depend on the Canadian training, and a number of officers have have not been sent for a while on that training again because of financial constraints. So what we rely on really is consultancies. And it's also very difficult to get the type of consultant for that kind of impact assessment.
Well, I understand the challenge, but interestingly though, you mentioned that the Ministry of Planning and Development has this National Transformation Unit, which I know is the unit that is in charge of impact assessment and most project evaluations. Now, so what has been the extent of, because I also heard that you said that the two committees that you all have, the macro one and the one at the program level, the Ministry of Planning and Development, they are represented.
Yes, they are represented.
So is it possible to reach out to that division to have them assist the Ministry of Planning, Ministry of Social Development with these impact assessment capacity and enhancing the capacity at the ministry?
We have done so. So we asked the ministry to assist us in the past. They have done so, but also they have constraints, human resource constraints, because they have the responsibility for the results-based management framework for the entire public service. So they are also constrained by what they could provide, but we have collaborated in the past and we do collaborate.
Okay. A recommendation. There are few online courses that you don't necessarily have to pay for. You have staff that could audit these courses. edX offer them, Coursera offers them on an interim basis that does impact assessment training. And I think it's through the organization JPAL. So you could probably look into that, or maybe even reach out to the organization directly. Just a suggestion for the ministry. Now,
Sorry, could you tell me the name again? JPAL, is it?
JPAL is the
JPAL.
acronym. Is the acronym. I will look
Sure.
up for the full name and I'll let you know.
Thanks.
Also, I know that, Madam Chair, I have another question. I also know that a public expenditure review was done recently, and it also looked at the Ministry of Social Development. And this was done by the World Bank, I believe. And in their conclusion, they indicated that the social safety net in Trinidad and Tobago is way higher than it is across the region, the Caribbean region. They said that 4% in Trinidad and Tobago, 4% of GDP in Trinidad and Tobago compared to 1.5% in the rest of the region. So could you give us some insights as to what came out of this public expenditure review? Any inefficiencies that were pointed out, and what is being done within the ministry to address these inefficiencies?
I'm aware of the report that you speak to. However, Cabinet had taken a decision with respect to that report that the ministries would review the report. However, no decision or action would be taken until Cabinet itself reviews whatever recommendation comes forward. So in most of the ministries, we haven't gone forward with the recommendations. They're still, I think, to be reviewed again by Cabinet in terms of a final decision as to what should be done in the ministries. I know with respect to the Ministry of Social Development, there were recommendations with respect to some units that should no longer be operated and so on. And there were far-reaching implications with respect to the recommendations, which is why Cabinet had indicated that they had to give a final decision on what action is to be taken on those recommendations.
Okay. Earlier on, you would have mentioned that there are a few vacant posts in the ministry. Could you tell us how many of the public service posts remain vacant at this moment?
Ms. Bell? It's a public service type post, yes? Under Service Commission.
Okay, and the number of vacant positions, there are 200 vacant positions. The number of vacant positions with bodies, that's 180.
With what, sorry?
Vacant positions with bodies. And number of vacant positions without bodies, 122.
Okay, thank you. And also, mention was made that there are some divisions that are currently being restructured.
Yes, so some division, the ministry is being restructured, but there are some divisions that are no longer operating under the
divisions are
ministry.
those?
This will be the targeted conditional cash transfer program, that unit. The poverty unit, it was 2 units, the delivery side and the policy side, and the unit that dealt with people issues resolution.
Oh, that is interesting. How come the poverty unit has been dismantled? And that is one of the strategic objectives of the ministry.
At that point in time, there was some concern that, well, initially, the life of the units, because they were all contract positions, came to an end. And when it came to an end, there was a view that we should look again at the structure of the ministry to determine whether the role of those divisions could actually be undertaken by the existing research unit, policy unit, and M&E units of the ministry.
So it's expected now that the responsibility of that strategic objective of poverty reduction and vulnerability is now going to be absorbed into policy and research?
Those units. However, again, that would have been considered by the team looking at the restructuring in the Ministry of Public Administration. So I'm not sure what is in the report in terms of what they have decided with that.
Okay, all right, thank you.
Member Mesteroy?
I was trying to find the line item under which your program where you provide caregivers for senior citizens. Which one, where is that on?
The GAP or the senior citizens?
The caregivers, well, the caregivers are provided.
GAP program, yes. It's under the item that says,
Social programs agent, is that it?
No. It's under a strange heading, National Service.
National Service. What has been your allocation and your releases to date?
The allocation for this fiscal is 20 million. And we would have used up at the end of February 6.9 million.
6.9 million.
Yeah.
How many caregivers you have in the program?
Initially, we had 600, but we got approval for 200 additional, 800.
800? Okay. Do they receive a stipend or what is the arrangement?
Yes, they receive a stipend.
And the stipend is paid out on time every month?
We have some challenges with respect to paying them on time because of the nature of the program. Usually we can't pay until we get all the timesheets in and so on. And even for the timesheets to be done, we have to get information from the carers, the persons who are being cared for. Okay. And so it takes some time to get into the accounts division.
Okay. What do you think could be done to improve the process so that the stipends could be paid in a more timely fashion? Because I know sometimes if you don't receive your stipend, you might not be able to go to the home to care for the person. And then that would create a certain of a dynamic where the person is being cared for. You have to adjust to somebody filling in or whatever, and it could cause problems. What could be done
Yes.
to improve the process?
We are aware and we have been looking at it, even with the evaluation of the program. We are considering how we could improve the process because we know it could really be quite a burden on some of the caregivers.
How far you in terms of the evaluation?
We are finished with the evaluation. It's really just to take it to cabinet and to begin to implement the recommendations. But we're not waiting to, some of the recommendations could be implemented right away. For example, we have increased the number, but we have to take it to cabinet.
You mind sharing some of the, or you have to wait until it goes cabinet before you share the information?
Generally, it has to do with what the objectives were of the program, improving on the objectives, and also how the program has actually been implemented. Because initially, the program was supposed to train you, and then you would get some on-the-job sort of experience for a period of 6 to 9 months, and then you would exit the program, but it hasn't been working like that. So, for example, one of the recommendations would be that we have to get back to the program and how it was supposed to be implemented, and also in terms of even the age category and for that program. However, even in implementing it, we would have had to change some things. For example, while we would have targeted young persons going out in the field, you would know that most of those persons, older persons, really don't want younger persons to work with them for different reasons. And so we had to begin to bring on more mature persons to be able to really meet the needs. So the assessment speaks to those kinds of issues on how, we could really treat with them and bring the program back to what the initial intent was.
Just one more question on that. You mentioned that initially you receive a certain length of training. I think it's a 6 to 9 months OJT period, and then you're supposed to transition out.
You receive the training, and then after the training, you have a period to sort of work out there with an older person, and then after you exit. So when you exit, you would have had the experience, and therefore you could get a full-time job, because it wasn't intended to be a full-time job, but it's more or less morphed into something like that.
So it's expected that either the family or an agency recruit the person and not necessarily
That's
ministry.
right, a home for older person or a hospital or some one of those types of agencies.
And if a family decides to retain the individual, is it a practice for the ministry to assist with the payment, or the family would have to absorb that full cost?
The family would absorb.
Okay, thank you.
Member Bodo?
Madam Chair, Madam PS, this next question is tied in really to the rehabilitation services for substance abuse and the responsibility for the Piparo Empowerment Center. But the question really is your ministry the only agency that is involved or responsible for these rehabilitation services for substance abuse? And secondly, do we have an idea of the needs, the extent for this service? If I may just add maybe 2 more questions, so you can just respond. And the other would be whether the ministry would engage private providers in this field, and if so, whether those providers will undergo some sort of certification or accreditation or quality assurance process.
So the ministry is not the only ministry responsible for this particular area. Some of these private organizations, well, primarily NGOs do, receive a subvention from the Ministry of Health. We run the Piparo Empowerment Center. Actually, the staff belong to the ministry and so on. The needs, when we had NADAP, that's the National Alcohol and Drug Abuse Prevention Program, was under the ministry, we would have a number of surveys undertaken in terms of alcoholism use by youth and so on, and we had have a sense of what the needs would be. But at this point in time, because NADAP is now in Ministry of Health, I mean, I'm not too sure whether these surveys are still being done and so on. But we, through the Interministerial Research Council, we do get a sense of surveys that are being done and so on. But to say that we're tracking the needs with respect to that particular service, not really. The facility has a capacity for 50 persons, and we've had challenges in terms of, in the last 5 years or so, with respect to having the facility filled. Prior to 2015, for example, there was an issue with respect to actually having enough accommodation at that facility. But it would seem that the whole dynamic with respect to drug use and abuse has changed, so that, you know, usually we don't even have half the capacity there anymore. Obviously, what we have done is we have decided to work with Ministry of Health to see how we can ensure that we have more persons at the facility and what's really happening in terms of, as I said, that particular service and the types of drugs that are being used right now. It's a little different, it would seem.
It's a big social issue, Madam PS. I'm sure you'll agree. Do you feel the current arrangement is ideal, or do you believe that the needs of these citizens will be best served by, you know, one oversight body or ministry? I would just like to get your opinion on that.
We have considered it. We have had discussions with Ministry of Health. Recently, we had 2 facilities down at Piparo. We had the Piparo Empowerment Center for alcohol and drug abuse and rehabilitation, and we also had the New Horizon facility for strictly homeless persons with a mental health problem. And because of the discussions, we have now handed over that facility to Health, understanding that it's better placed there. We would have had the same discussion about Piparo Empowerment Center. We're still having that discussion to determine what's best, where's best located.
So, Madam Pierce, I just want to go back a bit to your strategic plan. And I had observed that your monitoring and evaluation division was responsible for tracking and monitoring your plans and your proposals. Now, in your opening submission and also some time along the discussion, we were told about your human resource challenges, both in terms of the public sector, public service posts and your contract posts. So I wanted to find out, in terms of your monitoring and evaluation division, which is really important, it's almost your mechanism for tracking. What is your complement, your vacancies, and how has that affected the operation of your monitoring and evaluation unit?
Thank you, Chair. The monitoring and evaluation unit of the ministry, actually, we were one of the first ministries in the social sector to have an M&E unit because of the nature of our work. And we have always had a very strong unit. However, there was a hiatus where we didn't have anybody in the unit. It was just about 1 person or 2 persons. But recently, we would have had the 6 officers at the lower level, because as the structure, the lower level, the entry level, we have 6 officers, and then we have a director, and we recently got the director. So as far as I know, I think we have our full complement, Ms. Bell.
From what I'm seeing, according to the record, there are 6 positions that are filled, 5 are vacant. There's a total of 11 positions recommendations have to be made for the filling of the other 5, the remaining.
Okay, so the other 5, though, may be support persons rather than technical persons. So the
Correct.
technical persons are on board, and I think the main issue there has to do with the training, as Member Dionarine mentioned, the training to undertake the types of assessments that are necessary. So they can do the basic impact, not impact, but assessments of the programs and so on, but rapid assessments and so on, but the impact assessment is need for that type of training.
Okay, so you said there's a template that you've developed, and this allows for monthly status reports. So I guess with having your 6 officers, have these reports been happening monthly? And when have you received the last report for from this monitoring and evaluation division?
Okay, so the unit is responsible for providing monthly reports on all the programs and all the services that the ministry provides through the various divisions, and the most recent report would have been January.
And that would be for all the divisions?
All the divisions.
All right, so the report, generally, when is the report expected?
Usually heads are asked to provide those reports by the 2nd week of the following month.
All right, so I mean we're now approaching that time for your February report. And we were told about you developing a monitor and evaluation framework. Could you tell us the status of that?
We haven't advanced on that one because, as I indicated, the director only came in recently, and that requires some technical work and some guidance by somebody at that level. So while we would have been working with the results-based framework from the Ministry of Planning, which also is what we would use to do ours, because everybody has to be guided by that, there are some peculiarities for our framework because it would have to include our strategic plan elements and also the National Social Mitigation Plan. So we're not very advanced with respect to that particular overarching M&E framework for the ministry, but it's on the front burner for that particular unit.
Okay, let me ask, when did the director come on board?
Last week.
Oh, so it's pretty recent.
Very recent.
Pretty recent.
Yeah,
okay, so I guess I might be a bit premature to ask if you can give me some sort of estimate of time when your framework could be developed. But I guess that is something. End of fiscal 2020, you think that'll be, so, okay. So in terms of the vacant posts, which are the 5, as you say, the lower level people, would I be correct in saying that?
It's support, so it might be business operations, person, that kind of.
Those are contract or?
All contract.
All contract.
All contract.
All right, have you advertised anything for them?
Not for those. We were concentrating mostly on the technical, like the director.
All right, so that, can I ask then, when it's likely that you would begin the process of recruitment of the 5? And when I say recruitment, I'm starting from advertisement.
Chair, for example, if it's a business operations assistant position, what we do is we recruit across the ministry so that the next time we are recruiting business operation assistants, we will bring on someone for that particular division. And I think if I recall, it's probably the next 2 months or so we may be doing the interviews for that position.
Okay, so in terms of the 5, what I'd ask you is if you would submit in writing what level of people these are and your plan for recruitment of those positions. And I wanted also to inquire a bit into your social investigation unit, because I see you've done your assessment of your strengths, weaknesses, opportunities, and challenges. So I wanted to find out in terms of your human resource complement for your social investigation units, how many persons you have employed with that as of February 1st, 2020. And, you know, while you're giving me that, if you could give me a list of the established posts and the approved organizational structure.
For that particular division or
Yes.
as a ministry?
No.
In for
The
that
social
particular.
investigation unit.
Okay. So the social investigations unit is entirely contract primarily. If there are any public service posts, it would be that we would have reassigned some of the posts in another division that is relevant to research into that division. So we have a director, social investigations, which is currently vacant, but there is a body there. There is somebody that is in the position, serving in that capacity. We have a senior research specialist, which is a post that is supposed to be filled within the next month because interviews were done and someone was selected. It's just to have the person come on board. We have a research specialist. Just to go back a bit, the director's position, sorry, the person who is in the post, I think they're there for just a year, but they're on contract. It's not short term, they're on contract.
Okay, so,
Yeah?
so the year will end when?
The year would end probably in the next 6 months or so, 6 or 7 months, yeah. Because there were persons on the posts, but they resigned and so on. So this was just the residue. And so the person was just on for 1 year. Yeah, so the senior research specialist, that person will be on within the next month. We have 3 research specialists, 2 positions, and we have 2 persons. 2 are filled, 1 is vacant. Then we have research specialists, 4 posts, 1 filled, 3 vacant. We have a statistical specialist position. We recently had someone in the post, but they resigned. So we have actually re-advertised that post recently. The data specialist post, we have 1 vacant post. We also have another research specialist post that is vacant. Research technician, we have someone in that position, and that's the complement.
Right. So, you'd shown that you place great reliance on the monitor and evaluation unit and also the social investigation unit on analyzing and assessing your strengths and your weaknesses and so. So having regard to, as you told me, there was a hiatus with respect to this strong monitor and evaluation unit. It appears that you only as recently as maybe last month, last 2 weeks, been able to get back some of your strength in monitoring and evaluation. And I see you also have deficiencies in human resources in your social investigation unit. How has that really impacted your measurement of the efficiency of the services which your ministry provides?
Well, it has impacted because we didn't have the resources to really go out and first collect the data. We have a lot of data in files, which need to be mined. With the recruitment of our Director of Social Investigations, that was the first remit that was given to the division for them to come up with the system to collect the data across the ministry and to analyze the data to determine how we could improve what we do in terms of our programming and services and so on. They're still working on that. In terms, it involves an IT system also. And I know is that we were having discussions with the CSO because he would know that they are moving towards the Statistical Institute. And for the entire statistical system to work, whatever we are going to be using to send the information to the CSO to be able to say what is happening with social indicators across the country, we would have to make sure that it's compatible. So those discussions have been had, and we are looking at what would be the best solution to bring on board. So there's the IT solution, and then there's the part where we have to ensure that all the divisions are in sync with actually sending the data to that unit on a monthly basis, and to institutionalize this whole arrangement. So we haven't advanced that as yet, but we are working on it. And we are also working on the policy aspect too, because the policy division is the other important division in this whole arrangement, in terms of determining what we do, how we do it, and whether we're doing it well. And then, well, the M&E. Actually, what we've done in the ministry, we have an arrangement we call the Nexus, where those three divisions have to meet on a monthly basis to be looking at these types of issues in the ministry. How are we doing in particular areas with respect to policy and programming and so on? And while we haven't put the systems in place as yet, how can we actually improve what we do? So there's that Nexus team that meets every month to look at those kinds of issues.
And what, they generate reports that guide you all forward?
They haven't generated any reports, because actually they have only started a few months ago meeting again because of the mandate that was given to them.
So, you know, I get the impression that so many things are to be happening, and therefore it leaves me to wonder how you're managing, how you know how you're doing, how you know that you are reaching your target, how you know that your stakeholders, your customers are being satisfied. I mean, I heard you say that your appropriation is about $5 billion. I take that to almost also include your recurrent, or is that just on your programs?
It's mainly the recurrent, actually.
It's
because
mainly
of the nature of the programs, most of the money goes towards those grants.
Okay, so, and we know resources are never enough. What then, I mean, I hear all of these lovely plans to come into being, so, but what guides you now with respect to, are we being efficient? Are we being effective? Can we rely, we have lovely programs, but are we spending money? Are we getting value for money, or is this a wastage of funds? Because in all I've heard so far, lots of things are planned and to be rolled out, committees, you know, and so on. But I'm not sure, until those things come to fruition, what is actually guiding us, and by what we're using to assess the effectiveness and efficiency of what we're doing.
At this point, it's simply the reports that we get on a monthly basis in terms of these programs. How many persons are coming on board, how many persons are leaving in terms of the programs, and for some of the ones where we do assessments, what the assessment is saying. So for example, even like, for example, the senior centers program, we would have done an assessment of that to see if it's meeting its objectives. So in the absence of a robust M&E framework, we depend on the monthly reports and the assessments, and we are trusting that we would get the data very soon for the SLC. But that's what we depend on to determine how we are doing.
All right, now you have an internal audit unit?
Yes, the auditor is here.
Right, and could you let me know in terms of operations of the internal audit unit, the staffing, and reports generated by the internal audit on, say, programs or divisions, and how do you use those reports to guide and improve on the service delivery of your ministry?
Ms. McKee, you want to speak to the unit and what it does?
The composition of the unit. The unit has an auditor 2, 2 auditor 1s, 6 auditing assistants, and 2 clerk 2s, which are checking officers, and a typist.
Is that your full complement?
That's the full complement.
Okay. So in terms of, do you have an annual work program?
Yes, we do.
You do. And have you been doing audits, consistent with that?
We have been.
Okay. Could you tell us, like, what was the last audit you did into whether it's a division or a program? If there were any deficiencies or challenges that you had encountered?
We have a monthly plan, and we would have a number of audits on that plan every month. I think the most recent one that I can think of was to be audited TAHI, and we would have looked at their procurement of their contracts and their accounting, and looked at their internal controls and made recommendations on that.
Okay, so when you make TAHIs, is what, may I ask?
Trinidad and Tobago Association for Hearing Impaired.
Okay. And having done that, that would have been in what month you did that audit?
The report would have been placed last month. Would have been submitted last month.
All right. Has that report been shared as yet with the entity?
Yeah, TAHI would have seen they would have seen the report, and they would have given their response. Our
Yes.
completed report had their responses to our findings and recommendations.
Right.
So they would have known what was in it, and they would have a copy.
All right. So is there any specific issue you would have identified that you would like to speak to, and recommendations which you would have made in respect of that?
Well, we did look at the way they dealt with their purchasing and their sales of their batteries. They sell batteries as one of their main means of income outside of our subvention. And we looked at their stores records and the way they maintain those and made recommendations to those. That's what comes to mind immediately.
All right. And having done that and made the recommendations, you said you will have an opportunity to respond.
The completed report
Yes.
had their responses on it and timelines for when they would have made the improvements and made the changes that were necessary.
Right, and you will follow up on that.
And then we would do a follow-up audit.
So might I just ask the Permanent Secretary, you had spoken to a Permanent Secretary Procurement Evaluations Committee. Could you share with us what that is, who comprises? Well, I expect from the name is the Permanent Secretary, but who else comprises of that committee?
This committee would actually treat with procurement that is within the remit of the Permanent Secretary, which is under $1 million. Yes. It will comprise of different persons, depending on what is being procured. But generally, it would have somebody from the General Administration Division, sometimes the Project Management Division, and one other person, depending, as I said, on which division the procurement is being undertaken for. And this committee would usually sit on the what is received from the various suppliers and make a decision, well, not make a decision, but make a recommendation to the Permanent Secretary, and then I will determine and give the approval based on what is recommended.
All right, so this committee, this would be in addition to your procurement unit, according to the procurement legislation?
Yes, this is a committee separate and apart. The procurement unit would usually, undertake all that is required right now under the Act, although it's not proclaimed,
Right.
putting things in place in readiness and so on, and, beginning to do like the procurement plan that is necessary each fiscal and so on.
So that unit is not really actually overseeing procurement yet in your ministry? Because what I want to know is the relationship between your committee and the work of the procurement unit.
There's a relationship, and while we are saying procurement unit, that unit is really just public servants in the ministry. So that the person who is heading up the unit is really has a position in another division and is really being used there in the interim while we're trying to get the persons for that particular unit. And so that person is usually also on the committee. So that's where the link is.
Okay, and just as we talk in procurement, do you have an idea of when your unit will be completely established? You have an approved structure for your unit?
We have an
Yes?
approved structure.
Do you have an idea when your unit is going to be completely established?
I can't say, but I could indicate that there is a cabinet note done to go forward with respect to filling some of the positions, a very limited number.
Okay, thank you very much. Anybody? Member Dion Ryan.
Thank you, Madam Chair. Madam Permanent Secretary, mention was made about, in your submission, about the project selection criteria. What does the project selection criteria entail?
Could you just say where it was mentioned?
Pages 20 to 21. It says projects are selected based on project selection criteria, which are then formulated into the ministry's strategic work plan for the fiscal year.
Okay. Well, the project selection criteria would actually be relevant to what the type of project being undertaken, yeah? So we have some projects that will be done under our new projects that will be done under our PPPD, Policy and Development Division, because there was a decision taken that if you're doing any new programs, that is the division that will develop it according to the template for developing new programs. And then there are projects that are developed which are under the PSIP, which are the more infrastructural type projects, okay? So if we are doing a program in terms of PPPDD, the project selection criteria would usually involve, okay, so what is the priority of the ministry right now? What is the target group involved? And so on, you know, so that we could determine which one to select. Because given the financial constraints, we have to be very selective in terms of which programs we put on the front burner and which ones might go down a little lower, or which ones we might be able to do with an international agency and so on. So I think that is what we would have spoken to when we talked about project selection criteria. Yeah.
Okay, I asked because I'm wondering the extent to which the project selection criteria is linked to the goals and objectives of the sustainable development goals.
They are linked primarily to our strategic plan and Vision 2030. That's what they linked with most of all. But you know, Vision 2030 is also linked to the sustainable development goals. So in a way, indirectly, it's linked that way.
But each theme in the in the Vision 2030 plan is linked to a particular
yes, so that's why I said indirectly it will be linked to the sustainable development goals too.
Okay, so could you tell me which goals most of your programs are impacting on right now?
Most of them would be related to poverty. Okay. And inclusion in terms of inequalities and so on, where we bring in persons with disabilities and those kinds of target groups.
Okay. So I want to move to programs that you all do with CBOs and NGOs. Now, in your introduction, you did mention that approximately $41 million is given in subvention to NGOs and CBOs. Right now, how many projects you have with NGOs and CBOs?
We don't have projects, but what we do is we provide a subvention to them for them to provide services to particular vulnerable groups. So we have about 25 that we provide subventions to, including the statutory boards that one of which was TAHI, and we also have Blind Welfare Association that we give a subvention. So TAHI, Blind Welfare Association, and the Lady Huchoy Home.
What criteria is used to grant these subventions?
Well, usually NGOs will submit requests to the ministry with respect to a subvention, and there is a process where the ministry will determine the type of services being provided, what is in keeping with what our remit is, and also we will determine how much, depending on how much they are asking for too. There is a guideline that was approved by Cabinet in terms of how we determine who we give and what we give. Various sub-themes, so it could be if it's disability, if it's children with disabilities, or whatever the kind of service if it's also abuse, whatever the services we would determine, and we have actually a template that we would use to assess.
Are you in a position to submit to us that template?
Yes, we could.
In writing, yeah.
Yes, we could submit what they use to determine and assess.
I want to move to homeless persons living in and around Port of Spain. What role the Ministry of Social Development plays in dealing and addressing this issue with displaced persons in and around Port of Spain?
So that particular remit of the ministry is under the purview of the Social Displacement Unit, and you would have some information too in terms of that unit. What that unit is responsible for is implementing what we call the continuum of care, which is a guideline that we use to provide services for street dwellers and homeless. So that unit works in collaboration with the other ministries that have responsibilities for various areas to treat with this issue along the continuum. But our ministry is primarily responsible for moral suasion, going out, engaging the persons on the street to encourage them to go to the facilities that we have available to do an assessment and determine where they should actually go for rehabilitation. So primarily our ministry is responsible for the collaboration with the other ministries to make sure they do what they have to do, but with respect to our remit, we engage the persons and we ensure that they get to a facility where they would get rehabilitation. So we would usually have primarily two types of persons on the street: persons who have a mental problem, and then persons who have an issue with drug abuse or alcoholism or something like that. Then there are some who don't have either of those, but they're homeless for some reason. So where persons are assessed that they have a mental problem, it means that they have to go to a facility to deal with that mental issue, and that's Ministry of Health, because we don't have the purview for those kinds of facilities. If it's drug use and abuse, obviously we have PEC, PIPARO, and we could also collaborate with some of the other agencies that provide that type of rehabilitation. If it's strictly homeless, we have the CSDP, which is the Center for Socially Displaced Persons over at Riverside, and we also have Court Shamrock in San Fernando that we could have those persons go to until, of course, they have to transition out because they can't stay there forever, and that's where we have a little challenge with respect to social housing, because this is housing for persons who really cannot make a rent of more than 1,000 or 1,500, so they would not be able to get a house from Ministry of Housing. And so we are the ones who have to work with housing to determine how to treat with these persons. And so there's that other aspect of social housing and transitional housing that we are working with the other ministries to address.
It sounds as if it's a lot, and it has a lot of collaboration to do with other.
It has a lot of
Other
collaboration to do with other
is it-
ministries, especially the removal of the person from the street, just to understand that the only action we could take is moral suasion. Any moving of the persons, if they have a mental issue, it's Ministry of Health. Or if it's taking them to court because they are loitering, it's the police. So, and the majority of persons on the street are not moving based on moral suasion.
Right. So all you can do is go and ask them to move.
Ask them
And
to
if-
move,
And at
and
that
if they
point in
agree,
time, if
take
you
them along.
discover that they're either mentally ill, if they are mentally ill, then you need to
get
call
the
Ministry
support
of
from
Health.
the Ministry of Health, where there are other issues in terms of the persons who are the mental health officers who have to take the person off the street. They have to be precepted. They have to get a particular authority to do that. And there are some technical legislative issues with that right now. So not many of them are able to do that.
So are you in a position to say or share with us the amount of displaced persons that you interact with or engage with on maybe a monthly, quarterly, or annual basis? Is there any record of how you, because if it's moral suasion, it's just members of the ministry going and asking these persons to move. But is there any documentation on you will ask using this method and then documenting who you contact to take care of the person and so on?
We do have records. We have just one field officer, unfortunately, right now, working in that unit that goes out under the moral suasion, and she provides reports on a monthly basis in terms of the numbers of persons that she engaged on the street and the numbers that actually go into facilities. So I think between 15 and 20, I would think might be the persons that she would engage on a monthly basis. Mr. Gangasad? Okay. In terms of persons who would actually go into the facilities, it would be much less. And sometimes even if they go in, remember there is no way that we can keep them there, so that within a short space of time, they may be back out on the streets.
Okay, so those reports that the unit have compiled, could you share it with us?
Sure.
And also, was there, well, clearly, was a needs assessment done for the unit, the displacement unit? Because it's just one person you're saying, right?
Well, there's one person there now, but that is another division where we have done recruitment, and they should have some more persons coming on board within a short space of time, like a month. So the interviews have been done already. Ms. Bell, you could share how much persons are in that unit with us?
Bishop, yes. Madam Chair, well, the executive director position has been filled. There's a senior social work specialist. It was advertised, that position was advertised, two business operation assistant, two. Those positions are to be advertised. Driver courier, one. That position was advertised last month. 5 field officers. The advertisement has already been done. They are awaiting approval for the recruitment of those persons. The social worker, there is 1 position, and a recommendation was made for that position to be filled. 1 business operation assistant, 1 position that has been advertised.
Thank you. When
You're
when do you expect, sorry, did I interrupt?
No, I say.
When do you expect all these positions to be filled? Because some of them have not been advertised yet.
Yes, the only ones that weren't advertised, all the technical ones have been advertised, and they're expected to come on board within the next month or so. As the field officer and the senior social work specialists and the social.
Okay. Another area I want to.
Just one moment, Mr. Gangosad, were you able to find the data?
Yes, just there's some available data here for Q1, Q2, and Q3 of last fiscal. In Q1, the ministry would have engaged on the street 112 persons. In
That is
Q2,
in Port of Spain only, or the entire country?
mainly in Port of Spain, right? In Q2, 142, and in Q3, 90 persons were engaged on the streets by the social displacement unit.
And what about the other areas of Trinidad, like San Fernando and maybe the rural areas?
Inside of this would be some for the areas outside of Port of Spain, so we'd have to submit that disaggregation.
Okay.
We'll also submit a recent report that was done on the street count. I think it was done in October last year in terms of determining how many persons are in the streets of Trinidad, not Tobago, only Trinidad.
I know you also mentioned that within a short period of time, even if you try to use moral suasion, you have the Ministry of Health intervene or the CTPS intervene. Most of the time, they tend to end up back on the street. At that point in time, what is your role? What are you in a position to do?
Re-engage them. That is all that we can do at this point.
Okay. I want to move to another area with respect to grants and programs by multilateral lending agencies. Do you all have any right now?
No.
Are you all considering seeking any? Because what I know is that multilateral lending agencies, they usually have technical assistance support in the sense that you don't need, it's not a loan. So it's grants that they give you to deal with these social issues, especially in an economy where crime is very prevalent and you have a social safety net that is increasing. Have consideration been given to reach out to any multilateral lending agencies?
We have been working with the UNDP with respect to poverty reduction and the development of the poverty strategy. And in recent time, we have been working with the Caribbean Development Bank with respect to an assessment of the disability sector.
Was that done?
It's now starting.
No, starting, okay. And when is it expected to be completed?
I think that project is going to take about a year.
Okay, you have like a project profile describing
Everything,
the
because they've
components?
done it before in other jurisdictions, so they're using the same template.
Okay, could you submit to that as well, to us that as well?
Sure.
Thank you.
Thank you. Member Webster Roy.
Thank you, Madam Chair. I had some follow-ups based on questions asked by Member Diana Ryan. The first one, you mentioned that if after health or another agency engages the street dwellers and they return to the streets, you'll just engage them again. What is NFS doing in terms of getting the family involved to have the person reintegrate into their family? What support is provided?
Usually the social displacement unit, there are social workers in there, and they are the ones who treat with the families of the persons who are homeless. Family services doesn't really get involved, yeah.
Okay. What I'm trying to get at is what is done to help to support the family so that they could engage the displaced person and have them back home. What is the ministry doing to help build back that family unit, to assist in building back the family unit?
Because I'm not operating at that level, I can't say exactly what they do with the family. I do know that for most of these persons, even if they find a family, it's usually very difficult for the family to accept the person, especially if it's mental health issues. Most times the family doesn't want the person back, and even if it's alcohol or drug abuse, and we put them in PEPARO, we work with them, I could say, with the families when we put them in PEPARO. I know that for sure. Some of them reintegrate, and some of them we have to find transitional homes or permanent kinds of accommodation for them after they leave there. But once they get to PEPARO Empowerment Center, we work with the families in a comprehensive way.
Follow-up had to do with the issue of subventions. I wanted to understand what is your mechanism for monitoring the subvention to ensure that there's value for money and that it's actually being used for the purpose given. And I wanted to specifically raise the blind welfare, but explain the process first, and I will explain to you why I wanted to raise the Blind Welfare Association.
With respect to the subventions, we have an NGO unit which oversees the provision of subventions to organizations, NGOs. Every month, the NGOs have to submit their actual expenditure information, which the NGO unit reviews, and also it determines what they get the next month. The amounts that they should get is determined by cabinet, so they are also overseeing that to ensure that they get what is approved. And also we have the auditing function, as Ms. McKee mentioned. Audit unit actually audits the accounting records of those NGOs.
Is the ministry aware of the current, I don't want to say impasse, but the current breakdown with the Blind Welfare Association, the general body, and what is happening in Tobago?
We are aware because we have had letters come into the ministry, so we are actually dealing with it right now. But just to indicate that those organizations, there is a limit at which the ministry could take action, especially if it doesn't have to do with the ministry the subvention that the ministry gives. So sometimes these issues have to do with governance of the organization, which the ministry may not have any jurisdiction over.
My final question is about the NSDP program. I wanted to get a status update, please, on the program.
It's the National Social Development Program. Mr. Gangasad, could you take this one? Responsible for that division.
Sure, thank you, PS. Through you, Chair. The NSDP program is an ongoing program that treats with house repairs, 3 major grants really: house repairs, house wiring, and electrical, house wiring, minor house repairs, plumbing, and house wiring. They also administer the SEED program, which is the Sewing Empowerment through Entrepreneurial Development. So that program is currently being administered, or continues to be administered in the ministry.
Is it being accessed nationwide, or is it a Trinidad only thing?
It's being accessed nationwide. In terms of Tobago, the applications usually are done through either the Social Welfare Division or through the food support unit in Tobago. So we have been receiving some, not many, I must admit, but some applications have been coming from Tobago, and these matters are to be addressed.
And what's the current status of your staff at the office in Tobago? That's my final question, Madam Chair. What's the status of your staff in Tobago?
The status of the staff in
The Tobago program and the NSDP.
right. In terms of NSDP, NSDP does not have a staff really assigned in Tobago. As I indicated, an arrangement is done where the food support or the social welfare division collects the application. That is sent to Trinidad. Those applications are then logged, and some arrangements has to be made as it relates to the processing of these applications. As it relates to the food support in Tobago is still in operation at the Canby office with a regional coordinator and I think four liaison officers at the Canby location.
Contract or short term?
These officers are on short term.
How long have they been on short term?
I believe, from my recollection, they would have been on short term since August 2017.
Okay. All right, Member Bodo.
Thank you. Thank you, Madam Chair. If I could just follow up on Member Roy's question about the National Social Development Program. And there's a table on page 11 of the submission here that speaks to the number of applications and beneficiaries. So I'm looking at house wiring. I'm not sure if you're all on the same page as yet. It's actually, sorry, did I say page? It's page 31, sorry. Page 31 of the submission. NSDP. So I'm looking at house wiring, materials and labor house wiring, materials only, minor house repairs, improved water supplies, electrification and lighting of community facilities. So two questions. One, are these separate from the benefits you can access through TNTEC and WASA and so on? And my other question would be why zero applications in some instances? Is there an explanation for that? It's a social program, and I find it's a little bit interesting that no applications would have been made. Because I'm sure as a member of parliament, I'm sure there's quite a need for this. Is there an explanation?
So Chair, through you again, the program is distinct from what is offered at other ministries.
Right.
Yeah, so this is a program administered by this ministry.
So it's available, and I say it's available, and the public should know of it.
It's available, and the public should know of it. And as I indicated earlier on, we would have been advertising this program through our various communication strategies. As it relates to the zero application here, this program, really the minor house repairs, is heavily subscribed. The other areas in terms of plumbing and house wiring is not as heavily subscribed as the others. The fact that they have zero application here probably would suggest that persons did not really apply during that period for these services, as they would have applied for the plumbing and the minor house repairs.
So can I ask, as part of your communication strategy, because as members of parliament, I'm sure that there would be need for this. As part of your communication strategy, this information is, do you make it an effort directly to target, for want of a better word, MPs' offices? That's the first question. And the second, in terms of the paperwork and the forms and so on for this, where would that be available? Yes, sub-officers.
So to answer your question, as I indicated earlier on, the Public Information and Education Series was in fact conducted in every constituency throughout Trinidad and Tobago. The approach would have been to engage MPs as well as councillors and other key stakeholders in the area, and those events were in fact well attended. The other approach that we are using is the outreach. And again, the ground in terms of getting the word there are the councillors, and as well we have engaged in some cases the MP offices so that persons can be informed to come out. And at these events, all of the services of the ministries are offered in terms of both at the outreaches. Now they're actually doing on-the-spot assessment to determine eligibility for these grants, as well as giving out information to citizens on how to go about qualifying and the relevant documentation that they need to submit in order to get the grants.
Sure, thank you. I just want to take you back to page 30, Madam PS, and look at this is under the benefits of projects and programs across Trinidad and Tobago, and the Social Welfare Division, and the column Food Support. That's on page 30. And I'm looking, if it's just for comparison, September 2018, 24,327 grants, number of persons benefited. And if I go down to December of 2019, I see a figure of 23,969. But in January of 2020, I'm seeing a figure of 11,157, almost a 50% reduction. Is this a typo, or is this reflects a change of policy? And do you have the figures for February 2020 so we can follow the pattern?
Right, so it is an error. In fact, the figure is 24,338.
Okay.
For January 2020, the figure is 24,338.
Okay, well, that's
24,338.
Do you have February figures there?
I don't have February
problem,
figure,
but
but I know the current figure as of March, I think, is 24,702.
All right, so there's no change in policy.
No.
I just wanted to clarify that.
Just might I just intervene, Mr. Ganga Prasad, before we go any further, are there any other errors in this matrix you've given us that you would want to point out one time so we wouldn't?
No, not. I actually saw this error just before we left the ministry.
Okay. If I can draw your attention to the third column, public assistance, and I see here September 2018, just for comparison, 23,150 citizens who have benefited. But in January of 2020, 18,286, a reduction of almost about 20% there. Is there an explanation? Is it something that varies, or is it a reflection of reduced funding?
It's really policy, I believe, reflecting the fact that we would have introduced a standard means tests for eligibility for this grant.
So those who may have qualified prior to.
Some persons, yes, would have fallen off, having been recertified to determine if they still, well, this particular one, they're still eligible for the grant.
Public assistance. I just want to go back to page 31, and just for a few comments on the Geriatric Adolescent Partnership Program, the GAP program, and the Retirees Adolescent Partnership Program, the RAP program. Can you give us a brief explanation as to how these programs are structured and their benefits, and how you go about accessing them?
Well, the GAP program is the one we would have spoken about with respect to the caregivers. So if you have an older person and you're unable to, pay for services for the person, then you apply through the GAP program and you get a caregiver who would provide the services for the older person. So there's a training element, so there's it for young persons. And then there is the caregiving part where you actually go out and provide care for older persons. Yeah? The RAP program is a program under the ministry that treats with vulnerable, at-risk young people, where we have retirees working with the young persons who may have been identified in their school as, having behavioral problems and so on, and the retirees would work with them after school in various areas in terms of helping them with their homeworks and life skills and counseling and mentorship. so that, you know, they get back on the right track, and also that they become citizens who will move on and fulfill their potential. So we have, I think, about 5 centers, and we have forms that you can fill out to be part of this program.
The retirees, do you have a number, do you have like a number that participates in the program?
The
Or
number
does
of,
it vary of retirees who would
it
engage these
would
young people?
vary, but I don't have the figure in terms of the number of retirees we have in the program right now. I don't have that figure readily.
Is that something you can provide?
I
to us
could
in
provide that.
I mean, it's a reflection of how much people are willing to help back in society. And is there any particular, would there be criteria for participating as a retiree in that?
There will be criteria that would be provided. Most likely you're willing, and you probably would have been a teacher or whatever is the need that they're looking for, sometimes in the area of sport or so on. So
Yeah, it's not something
have
that
a
is very
criteria.
well advertised, though, the opportunity for retirees to give back in this way. So it's just a suggestion that I'm sure there are many
Sure.
retirees who are willing and able to participate in this service, and perhaps you might want to look, you know, at advertising this maybe a bit more
Yes,
heavily.
understood, agreed.
P.S. I just would like to follow up on this, the same RAP program. What you told us at page 32, there are 257 participants. Would that be total, meaning retirees and students? Or this would be the
This
young
would have
people?
been the young people.
All right, and so this is what the current cohort of young people in the 5 centers are?
It may be a little different because this information was 2019
Okay,
information.
so you could give us an update on that, please?
Yes, sure.
And also you had indicated to us that there were plans underway to expand the number of centers. Could you tell us, because the centers are 5, Couva, Belmont, Aokata, Valencia, and Laventille, am I correct?
Yes.
Okay, so could you tell us what is the status of the plans to expand the number of RAP centers?
We haven't expanded as yet. We're still at the 5.
It's still at the 5, I know, but
Yes.
have you identified areas? Has your kickback been funding? Has your kickback been identifying schools? Has your kickback been identifying retirees? That sort of thing is what I'm trying to find out.
It's not identifying. We have had some challenges identifying centers, but I think the challenge is just to simply move towards implementing and getting the additional on board and taking it to cabinet too, because it will have to be taken to cabinet.
All right, so you can give us a time frame?
We will commit to the next 3 months, Chair.
Okay, so you give us a report of that. And I would really like us to get some in writing, what are the criteria for selection of retirees? And how long does a program run? So I'm a child in school, who identifies that I'm giving trouble?
It usually would be the social worker in the school.
Okay, and how long do I go to this program for?
It's determined by the coordinator of the program. I believe they will work with the young person until they see the change that is necessary. So it may be 9 months, it may be a year.
What is the skill or expertise of the coordinator?
The coordinator on board, that person, Ms. Bell, do you have the qualifications for the coordinator for that position? The coordinator for RAP, we would have to get it, but essentially the person would have to have a degree, and they would have had experience in working with young persons and with youth programs.
Yeah. All right, so what I would ask is for us to get a fuller understanding of this RAP program, which we think is a great program. If you can, in writing, give us some more information about how this program is administered, the criteria for selection of the retirees, the qualifications of the person who assess the children, how long they stay in it. I guess it will vary, but I want to know if I could be 6 years in the program. That's what I'm really asking. Yeah, that sort of thing. Okay, and lease. I don't know about anybody else here around the table, but lease. I be accused of neglecting my own. I would like us to talk about vision of aging. Because, you know, our understanding is that we are aging population. And I see we do have a division of aging. And I see you have a number of programs administered by the Division of Aging. And I would just like to get some further information about these programs. So I see the Older Persons Information Center. Is it that there is one hub located in your ministry, or do you have them in various regions, whether it's in a regional corporation or some out centers or so on?
It's a hub in the ministry.
It's a hub in the ministry.
800 line.
An 800 line. So it is just really an electronic information interface.
It is, but it's also the conduit for receiving reports on elder abuse.
Okay.
So we receive reports on elder abuse through the OPIC Center, and also it's a place that older persons come in to get information about older persons.
Okay. So, it's sort of like a repository of information.
Yes.
Available to everybody, all public. Okay. What do you all do as the recipient of complaints for elder abuse?
We receive the reports, and the inspectors in the division will go out and investigate. Depending on the nature of the report, they will also work with the police when they go out to determine whether there is any truth to the report, and based on what they find, they will determine the action. So if it's, yes, it's abuse, they would actually have the police involved to remove the person or to deal with the issue. And if it's something that is not a criminal offense, they would work with the family if they're allowed to. Now, there are two types of abuse that come in. Private homes, which they're a bit limited to deal with unless, you know, it's a physical abuse. They make sure they go in with the police to determine whether there is any validity. And if it's a home for older persons, then they have some more, they could do a lot more if it's a home for older persons under our jurisdiction, because we do have homes under our jurisdiction. So we would go in and we will work with the home in terms of the issue there.
Okay, so basically you all just treat with physical abuse?
No, there are different types. Recently, we had to report on what we do. So there's the financial abuse, there's the psychological, and there's the physical also, and, you know, so there are the various types.
All right, so how do you investigate psychological abuse?
I'm not sure how they deal with that, really. I'm not sure how they would deal with the psychological.
Okay. So if you could let us know, because, you know, it's quite interesting in what is abuse. So my mother may be a very independent 90-year-old woman, and therefore takes umbrage to, say, my intervention in trying to assist her. So that's one form of possible abuse, that I interfere with her independence. But then, on the other hand, if I leave her alone, right, and something goes awry, I'm going to be also culpable of another kind of abuse, neglect. Okay, so I'd like to know how you all treat with psychological abuse. And also, since you are a hub for information, how do you sensitize in an active way, not just my coming to you, but how do you sensitize in an active way people about elder abuse and its forms?
So at our outreaches, which was mentioned before, we do a lot of sharing of information on elder abuse. We also always observe World Elder Abuse Day, where we work with other agencies and also our own ministry in providing the information. There's information on our website and, about elder abuse. And we also, through our outreaches, provide the information. So through the PIEs, through the outreaches, through the website, through collaboration with other agencies, we provide the information out there and the education about elder abuse.
Okay, so can I ask one thing? Is there a definition of elder in Trinidad and Tobago?
I'm sure there may be. I'll have to. Mr. Gangosar is saying 60 years and over, but our old age pension is 65.
No, no,
so-
no. And I specifically asked that question, okay? Because I think Mr. Ganga Prasad is correct, that an elder person is a person 60 years and older. Many of us in Trinidad and Tobago, including you, not sure about that. And therefore, I asked that very basic question in terms of your public information and your public outreach, that many people are elders and according to legislation and just don't know that. Okay? I want to know in terms of, you collect this information about statistics, about complaints. Do you publish some sort of annual report or anything like that?
Yes, we have our administrative reports that we have to comply with according to parliamentary.
Right, but do you publish a little handbook that, is for public consumption, that is accessible on reports, number of reports, in homes, in private homes, that kind of thing, for sensitization, or even on your website?
We published those types of bulletins at one time through our Interministerial Research Council, but when the council life came to an end, we haven't published any since then. But we do have a bulletin that we produce in the ministry, but it's really, and we also put it on the website, I believe, that Socialite, that provides, what the ministry is doing, and we do provide some statistics in the Socialite, and we put it on our website.
Okay, so you just told me that the interministerial, this is the Research Council, its life came to an end?
Its life came to an end, but it was also reconstituted in 2018, I believe it is, so it's functioning still.
And
it's functioning now.
Yeah, and could you tell me sort of the qualifications of the persons that make up this research council? Even if you don't have it, you can supply that in writing.
Really, the council is reflects the social sector, and mostly the directors of all the social sector ministries are on that council because it's overseeing the social sector research agenda and ensuring that it's happening, and also identifying gaps in the research for social issues.
So there's somebody who's qualified with aging or gerontology or something like that?
Not necessarily, no.
Okay, so, and that's why I asked, because on the one hand, I heard it reflects the sector. So if you can give me in writing the actual skills composition of the person who make up this Interministerial Research Council. Okay, could you tell us about the community care program? Is that still operational?
Yes, the community care program is still operational. The intent of that program was really to ensure that we are providing accommodation for persons who are in the hospitals around the country, but they have been abandoned by family members, or they just don't have any family members. They may have come to this country from one of the smaller countries of the Caribbean, and they just ended up being alone and in the hospital, and therefore there's nowhere for them to go after they are actually dismissed from the hospital, discharged. And so our ministry would pay for them to be housed in homes for older persons.
Okay, so I see you've given us some statistics for October 2018 to June 2019. Could I ask if we could get some more updated statistics, please? And if one is one of these abandoned persons, placed in some home by you all, is it that the ministry would pay the expenses of the person's upkeep while in the home
Yes,
and for the rest of their lives?
for the rest of their lives.
Okay. And one that I'm really interested in is the Senior Activity Centers program. Has that been restarted?
Yes, it's been restarted.
And I know initially there were 5 centers. How many are there now? And where are they, so that the general public will know? And how do I qualify to enter one of these programs, apart from being 60 years and over?
Mr. Gangam, sir?
Yes. In terms of where they are located, I would defer and, ask that we provide that information in writing, because I do not want to misrepresent the where the 5 are actually located, as well as the criteria for accessing the program.
The senior centers program, though, there isn't really any criteria. It's just these centers that operate providing activities for older persons. And once you're in the area, and you could actually access the centers and get involved in the activities. It's really to, ensure the well-being of older persons,
But
so
I
that
don't even know
instead
where
of
the
staying.
centers are.
So the program had stopped, and we had some of the centers fall off in terms of the program because they couldn't continue to operate. So we had, for example, we have one in Maloney. We have a center in Maloney. We had a center in, is it Princetown, Rio Claro. Yeah, those were some of the areas, but we'd have to provide the information.
Okay, so let me ask this. Is this information on your website?
Yes.
Would I therefore see a center in Miaro, or would I see a center 10 Water Lane?
Yes, you would see
I'd see a
where it
specific
is.
address.
Yes, you'll see a specific address.
And this is not operated by your staff, it's operated by an NGO?
NGOs.
Is it fully funded by you all, or is some sort of submission?
Primarily, yes.
Okay, so that in terms of your funding, what is the policy to determine the allocation to any specific center?
Generally, according to the NGO government policy, it's maximum 60% of the expenditure of the NGOs. It changes somewhat. For example, when we give subventions to NGOs treating with homelessness, for example, or ex-prisoners, we usually give the 100% because it's really difficult for them to find the funding to meet the 40%. So there are some NGOs that will get 100%, but generally the rule of thumb is 60% of the expenditure of the organization.
So would I then, therefore, if I had to access this Senior Activity Centers program, be required to pay some fee?
Depending on the center. So if the center's expenses are beyond the 60% that we give them, they may charge a fee to the persons who are participating.
Okay, so would you know which centers
should
be charging a fee?
We will know which ones are charging.
All right, so could you give us all that information? And might I know, Mr. Ganga Prasad, am I 55 or 60 to qualify to go to the center?
55 and over.
55 and
Yes.
over. Okay. And as you said, that the program has restarted. So this status that you gave us of June 2019 about a note being submitted to Cabinet for the resumption, all of that is past tense. The note has been done, it's been approved by Cabinet, and you now have a not certain number right now, but you will tell us the number.
Yeah.
All right, good, and the locations. And this homes for older persons. We still have 9? 8. So which one we lost?
I think we, Chaguanas and Mayaro.
So we have
Two,
7.
actually, yeah.
At the time that those were, why were those discontinued?
The home in Chaguanas, I think it was just an issue of the organization that was running it,
Yeah.
just stopped the program.
All right.
Yeah.
So were there residents there at the time?
Yeah, there would have been residents who would have been relocated.
By you all to other homes?
Or the organization, once they were closing off.
Okay. And the one in Miaro?
The one in Mayaro, again, I think the issue was management and the fact that many of these homes were set up many, many, many years ago, sometimes by a village council, and with the village councils, there's the issue of new, younger persons joining, and they don't really have many of those, and therefore, after the ones who are there, the founding persons move on, there really isn't anybody to manage. So I think this Mayaro one was like that.
Okay. And therefore, let me just ask some things, and this is really for the public. I see it's really for people who are socially isolated and or indigent. So what happens with respect to the financing of their maintenance and care? Is it that you provide a subvention to the home, or
Which
are these
covers
people
that.
do they get social assistance too?
Some persons get social assistance in some of those homes still.
And in
Senior
addition to
citizens
this,
pension and so
you
on.
all pay towards their care too?
Once we are paying a subvention, the policy is that those persons shouldn't get an additional grant from the government.
Right.
That's the policy.
So that
Sometimes they are in private homes, they get their grants.
okay, so but we're talking about these homes for older persons. If somebody qualifies to be in a home for older persons, they won't be getting.
Not any homes that we give subventions, it's just these 7 as it is right now.
Yeah, and those are the ones you're talking about. Homes for older persons under your program.
You're right.
The 7 are what we're talking about. Okay? The residents in there would not be getting any grants from the government.
Should not, as far as the policy goes.
Okay? And therefore, it would be your subventions that is running the home.
Yes,
So it's,
and providing for them.
Is it fully funded?
It's fully funded.
Okay.
Those
so
homes.
Those homes are fully funded. So if you could help me, and I don't know if I'm looking at the expenditure statements that you had sent us in the course of this morning. And I think that is 002, would I be correct?
Um, 04, and the current transfer and subsidies on page, doesn't have a page number, but current transfers and subsidies 04, it's 0428, yeah? Senior citizens' homes. Yes?
Right. 04 28.
Yes.
All right. So in terms of that,
1 million,
Right.
$1.2 million.
okay, and up to January, there was a disbursement of 705,000.
5,000. 840.
Okay, what happens, would that have been covered up to January, or would have that covered a period beyond January?
This is, they're getting,
Quarterly?
they're getting their disbursements monthly. So this would take up to February.
So this 705,842 would have taken us up to February?
Disbursement up to February.
Okay, so roughly monthly, what the disbursement accounts
Actually, they have different amounts for each home.
Yeah, but when you have it here under 28,
Mm-hmm.
you giving me a total.
Yeah, it
So
is a
all I'm asking,
total.
what your monthly total of the subvention is?
Right, so what I'm saying, each home have a different amount, so I'll have to get that. And so I'm not sure how much each home would get to make up this MO58 foot. Yeah,
Okay, I
I'll have to
understand
give you that information.
But the total of the 7 homes,
Mm-hmm.
what is that monthly?
Right, so that's
You
what
wouldn't
I'm
know
saying.
unless you give me
No.
each one and
Yeah,
add.
yeah.
All right, because I just want to ensure that this $705,842
Yes.
doesn't have a deficit in it.
Yeah, I don't think there's a deficit in it. We try to give the homes what they're supposed to get each month.
Okay. And you try to give them on time.
Yes.
Okay. All right, Dr. Bodo?
Thank you, Madam Chair. I just wanted to follow up with regards and stay on the issue of abuse of the elderly. That the Older Patients Information Center, I see here that they received 147 reports from private residences, domiciles. Can you define and explain what you mean by private residence?
Well, the private residence would be in persons' homes. In the person home where they live with their family.
Okay, so that's nothing to do with a state.
No, usually we can't go in, as I said, unless it's a physical abuse report, and then we bring the police in because they will have the authority to go into a private residence.
So normally it's a member of the family who is living in the home.
It's a member of the family who is abusing.
So we don't have, like how in other countries you might have private nursing homes in the US, for example. Do we have those in Trinidad?
There are those that we don't give a subvention.
Right. But is there any regulation of those homes? Do you have to meet specific criteria? Is there any monitoring of these homes?
Under the Private Hospitals Act right now, that's where they're regulated.
Do you have any idea of the number of these residences? I don't know, what's
The
the correct term to use for these?
Older persons' homes.
Okay.
Yeah. And the last count, it was just over 200 in the
200.
country. Just over about 212 or so, I believe.
And those, so they have to be certified, you have an inspection process and so on? But that doesn't come under your ministry?
Not right now until the Older Persons Homes Act is proclaimed, which it hasn't been proclaimed as yet, and that's why they fall under the private hospitals.
Which will be the Ministry of Health at this point in time?
Under the Ministry of Health, yes.
Okay, thank you.
Just as you said something, it just reminded me. You all had appeared before the GSC Social Services, and there seemed to have been some, and this may have been my impression, some sort of uncertainty with respect to regulating of these homes between yourselves and the Ministry of Health. Who took the lead? Has that been resolved?
It has been resolved because we have agreed that without the proclamation of the Homes for Older Persons Act, the authority is the Ministry of Health. And the Ministry of Health is overseeing right now, if they have to get certification, it's from the Ministry of Health.
Any idea when the act will be proclaimed?
We've been working towards that. Right now, we have to liaise again with some of the key stakeholders, the homes and the association, with respect to the changes that we're proposing for the act and the regulations. Yeah, so not within another 3 months.
And just as because you're an agent, I just wanted to ask you, this is 02 goods and services. This would be a division within your ministry. Okay, would I be correct?
Where are you reading?
In February, and this is 02 goods and services, 002 division of aging.
Yes, that would be the division of aging in the ministry.
Okay, so can I ask, I see up to January, the expenditure was $453,284.
Yes, only
Right.
for contract employment, meaning the officers who work in the division, the
Okay.
inspectors and
Okay.
the director and so on.
So would I be correct in saying that the 99,681 for February is a reflection of what the monthly expenditure is on contract employment, or has that
In
changed?
that
in February?
division,
In that division, yeah, in that division.
yes.
And in terms of promotions, publicity, and printing, I see that there's an allocation for 800,000. And having regard to 80,000, sorry, and having regard to the hub that you all are, I see that there's been no expenditure to date. Could you explain
Yes,
that?
because once we're doing promotions and publicity and printing, it's usually done under another vote under the general administration, which is a sort of way that we manage the finances. Well, not we, but generally how it's managed in the public service right now. You do all of your publicity under that general administration vote, even if other divisions may have allocations.
Okay. So this remains money, if not touched, to be fired somewhere?
Well, you may have the money, but it's the releases, you may not get the releases.
You may have the allocation, but not the release.
Yes.
Okay, thank you. Member Deodorine.
Thank you, Madam Chair. I have several things that I would like to ask. I want to start off by, what is the poverty line that you all are working with right now? Is it the $1.90 declared by the World Bank, the international? What you all are working with?
You have that specific, Mr. Gamsa, do you have a specific figure?
Right, so the line that we are working with right now, as it relates to the poverty line, is 143902.
And what percentage of the population falls below that?
That we would have to wait on the exercise that will be done by CSO in the upcoming survey.
But in the existing 2005 SLC?
Would have been the 16.7%.
Okay.
The 2005 SLC would not have used the 143902. The 2005 SLC, I think the figure was 665. Right, and what we did is that we used the retail price index to bring the figure up to 2016. So that 143902 is the figure after considering the retail price index.
Okay. All right. Right now, do you all have any programs or any programs dealing with special needs children?
Well, other than the grants that we spoke about specifically with children with disabilities, what we would do, we would just support the NGOs that provide these types of services.
Through the subvention?
Through the subvention. We wouldn't, or if they're doing a specific program, they may come to the ministry to ask for a one-off grant, and it would be considered.
Okay. And what about collaboration with the Ministry of Education in terms of special needs education? You all have any role to play in that?
We collaborate in terms of providing advice and so on. And recently, we would have received approval from Cabinet for a committee, an interagency committee that would be looking at overseeing the implementation of the National Policy for Persons with Disabilities and the United Nations Convention on the Rights of Persons with Disabilities. So through that committee, there will also be the collaboration across the ministries and agencies.
But not necessarily specifically for special needs children?
Well, education is on the committee, and as such, because the policy includes recommendations for children with disability. That is how the collaboration would take place in terms of those programs, ensuring that they are implemented.
Okay. And what about programs or grants for teenage mothers, teenage pregnancy? Anything there?
No, but I don't know, Mr. Gangas, said any of the programs under social welfare may capture that group?
Not directly or deliberately. I just wanted to go back to the issue of special needs. Under the Public Assistance Act, provisions is made there for a single parent who has to stay home and care for a child with a disability. That parent is also provided with support, a public assistance grant, to care for that. Well, to provide for themselves while they care for a child.
Go back to the means test that you mentioned very early on in the hearing. You said that a revision was done to the means test in 2018?
It was implemented in March 2018, and of course, we gave ourselves, I think, a 9-month time frame to review, and so we have done a review with support from ECLAC. The findings we took to Cabinet, we sent to Cabinet in terms of what are our recommendations for the revision to the SMT.
Okay, so are you in a position to say how the revision to the means test that you all implemented in 2018 has impacted on accessibility to social programs?
The figures showed it, so that's why we would have indicated the reduction in the numbers of public assistance recipients. That's one of the impacts that we have seen, and also for food support.
Okay, so what would you say were the major factors that change in the revised means test?
So, sir, you want to explain that a little better?
Sure. The revised means test to the updated revised means test?
The one that you all implemented in 2018, for which you all submitted a report and recommendations to Cabinet.
Right. So when we implemented in 2018, it was the first time that we would have implemented a means test in the country. Prior to that, there were several approaches at targeting, none of which was scientific or aligned to the poverty studies or the poverty measures that are generated in the country. The review for the current revised means test was done in accordance with the measures that the country would usually adopt for defining poverty, which means simply what we did in 2016 to generate the new measures is the same approach we would have used to generate a new figure up to 2019.
Okay. Are you in a position to share with this committee in writing the recommendations that came out of that report with ECLAC?
As soon as we get a decision from Cabinet on the revision.
Okay. All right. Now, everyone in this room is fully aware with what is happening with the economy and the recent, not only the shocks in terms of COVID-19, but also the shock in terms of the energy prices. We have had this week we just had a recent collapse of energy prices. What if in a couple of years, Madam PS, you are asked that choose maybe 2 programs that needs streamlining or 2 programs that adds the least value to the citizens of Trinidad and Tobago? Which 2 programs those 2 would be?
That's quite a challenging question, member. In terms of, programs, I would probably just select programs where I know there may be a duplication in another ministry. So for example, National Social Development Program, I know there is a similar type program in the Ministry of Public Utilities. So I may identify that one to say, okay, let's look at how we could streamline it, and I might do the same for other programs that I know another ministry may be targeting the same clients.
Which other program you could say on the top of your head?
Some of the housing type programs, yes, that I know are across ministries, yeah, so self-help, and also some emergency programs where you provide emergency relief. We might be providing it, housing might be providing it, so those kinds of programs.
So why not suggestions are not already, or recommendations are not already being made to cabinet or whoever needs to make the decision to kind of combine these programs to ensure that that one entity is executing these programs? I'm not saying to remove the program. I'm saying to find a way to have one entity execute or implement the program and provide the benefit to the citizens. Because in terms of transaction cost of two entities executing the same thing, it means that is adding to your cost of doing things.
The recommendations were made. There was a committee that was appointed to look into this matter. There was a report that was done, and it's, with the particular ministry that had oversight for that particular exercise.
Okay. Now, Madam Permanent Secretary Sicharan, we didn't hear from you for the past 3 hours and 25 minutes. Would you care to share with this committee what is your role?
Okay, members. What happened is just that I recently joined the ministry just a couple of weeks ago.
Welcome.
So this session so far has been a learning experience for me as well.
Okay, so what area is your portfolio?
Okay, I've been given the Disability Affairs Unit, Procurement, HIV Unit.
Of course,
No.
because she's new, we try to help her along by not giving her too much at one time.
Okay, so learning as we're doing. Madam DPS Bell, what area are you focused on?
Well, I myself am relatively new to the ministry as well, just a little over 3 months. I deal with HR, general administration, adult education, GAP, RAP.
And Mr. DPS Ganga Prasad?
Unfortunately, I'm not new to the ministry. I have responsibility mainly for grant administration, that's Social Welfare Division, NSDP, PIPARO, the NGO unit, NSDP, I call NSDP already, IT as well, and the Division of Aging.
Okay. So, Madam PS Sobers, I would have indicated in terms of the impact assessment, JPAL is one source. I have the full name for you. It is the Abdul Latif Jamil Poverty Action Lab. Yeah. They're an institution in collaboration with MIT. And the name of the online program is Evaluating Social Programs. It's available on edX. And also, if you go on the website of JPAL, there are one-on-one programs that they do at a cost of $2,500 US per person. So options for you to consider. And why I'm focusing on this is because
Member, may I just intervene and really kind of caution about singular recommendations. Okay? Please. Thank you. But you could proceed along another line.
Okay, all right. Thanks. All right. Well, what I'm trying to say is that we're in a position where $5 billion is being spent on an annual basis for social programs in the country, for the welfare of the citizens of Trinidad and Tobago. We're also in a position where our benchmark for the poverty rate is delayed, significantly delayed. So assessment is a problem. Assessing impact is delayed, is also delayed. This is the monies that is being transferred to households in Trinidad and Tobago account for almost 40% of current transfers and subsidies. Transfers and subsidies account for 50% of total government expenditure. So it is critical that we are in a position as a ministry to ensure that we are able to assess the impact and the value that is being added to each one of the recipients of these programs. So not having to give singular recommendations, but consideration should be given to finding a way to do these impact assessments, even if it means collaboration, and assessing these programs. That's my final remarks.
Thank you.
And Madam PS, this is another one of my pets, gender responsive budgeting. And I've seen from the ministry's submissions that you all don't have any specific programs and projects to address gender equality. In fact, all your projects and programs are gender neutral. And therefore, I'd like really to understand that statement in the whole context of the Sustainable Development Goals, where no one is going to be left behind, and understanding that things are likely to impact men and women differently. So how do you marry this statement with leaving no one behind and the programs that you issue?
Chair, some training has been done by Office of the Prime Minister with, persons across the public service in terms of gender budgeting and the whole gender mainstreaming and so on. One of our officers in the ministry, she has been part of that arrangement. However, for it to actually roll out into how we do our budgeting is another issue. But when we say that our programs are gender neutral, it means that whether it's male or female, they could access it. So that facilitates any person who is vulnerable being able to get the support that they need. So in that respect, I don't think anyone should be left behind, because whoever needs support can get it.
Right.
I do agree, though, that we may need to streamline programs to ensure that some persons, and I should say males here, because what we have found is that most social programs are accessed by women. The men don't access the programs. Even the outreach programs, when we go out there, it's mostly men coming, and mostly women coming to find out what is available. The men are not coming.
Yeah.
So.
But, on the one hand, I understand the point in terms of there are programs available to persons. But in terms of, and I guess when you start to do your impact assessments, it may better help you look at how do these programs, while they're available to everybody, the actual delivery of the program, how does it impact men in terms of what you're targeting? How does it impact women? And I think the very statement you just shared shows that there may be something in the design or the publication of the program, while it is gender neutral, that may be leaving out or not reaching somebody. So I say all that to say that, with all due respect, there's nothing called gender neutral, right? So not a men's only program or women's only program. It's not that we're advocating, but it's a question of how do we reach you? How do we make you hear what we're saying? And it may be the very fact that it's gender neutral that men may think, that's for women, boy. Okay, so in terms of your service delivery, your policies, your programs, maybe the gender responsive is something, budgeting is something that we may have to look at. And I see that the good news is that you're saying that soon you'll be doing sex disaggregated reporting. Where are we with that and how soon? Because that might also help in devising your policies and your programs and how you distribute your limited resources to get a bigger impact.
So we have started in a limited way, and Mr. Gangamsad is the one who would usually collect the data for the reporting on particularly the grants and so on. So he could mention to the committee where we are with that.
Yes, thanks, Chair. Just from the available data that we have, knowing fully well that the data is, there's some level of challenge in terms of mining the data. But from the available data, I can say that 19% of our food card recipients is male-headed. And
90 or 90?
19, 19. And the other program that parallels persons who are usually coming to us in terms of poor programs is the public assistance grant. And 27.9% of those are male heads coming to apply, either for themselves and their dependents. So though the data is not, we have total figures, it is worthy of consideration that this would in fact reflect the national database of our two major grants for the food card and the public assistance.
Okay, and you wouldn't have any sort of data to suggest that this 19% and this 27.9% is reaching the vulnerable group of males?
The answer to that is no. I think what we need to do, and Pierre sort of alluded to it earlier on in terms of the importance of the study done by CSO. What we would have done for the first time in this country in 2018 would have been to align our targeting model to how CSO will determine who is poor from not poor. Now that we have done that, with the in time and with the data from CSO, we will be able to look at our database and be able to tell whether or not the numbers that CSO is pointing out in a particular area, whether or not in terms of catchment, we have the same numbers in our system. And if there's a disconnect, we will then be able to reorganize our strategy to make sure that people are not excluded.
Okay. Fiscal 2021 is too hopeful?
Fiscal
For the SLC, I think they indicated January 2021 to be complete.
So fiscal 2022. Okay, and thank you. And Ms. Auditor too, just that I do end on the note of the PS to give a little relief. When we were having our discussion, you told me the last audit you could recall is the TAHI. Okay, when you all had done the submission, you all had indicated the Golden Valley Care Services. I think that would have been in 2019. And if there would have been a report, an outcome report, if I'm correct?
Yes.
Yes? And having regard to your timeline for follow-up, I expect that would have been passed.
No, we did not do a follow-up because that matter is with the fraud squad.
It's with the fraud squad. Okay, let me ask something. You all have a fraud policy in the ministry?
We don't have an official fraud policy, but we deal with fraud matters as they come up in a particular way and according to what is required by the financial regulations.
And without pushing to know anything further, the matters with the fraud squad, you know how far that investigation has gone? Is it still ongoing?
It's still ongoing.
It's still ongoing. And the last thing, risk policy. Do we have a risk policy?
We don't have a risk policy. We treat with risk in terms of what audit would do.
Yeah.
But it did come up as an issue that has to be addressed across the public service in the audit report of the GSC that dealt with audit units of the public service.
Yeah, so where are you all with that? Because if we're talking sustainable development goals, my understanding is built into that is the understanding that there are risks. So that if you're going to achieve your goals, you have to assess your risk and know how you're going to mitigate and so on, your risk. So where are we in terms of our ministry in developing a risk policy?
We haven't started, Chair. I think the intent was that the risk policy would be a standardized policy across public service, which would usually be done by the central agency, which is public administration.
Okay, thank you very much. Member Webster Roy.
Madam Chair, for this opportunity. Madam PS, given your years of experience in the public service, what do you think could be done in the short, medium, and long term to improve efficiency within the ministry and the programs?
What could be done in the short term is for us to get our standard procedures in place so that we're doing the same thing across all the offices of the ministry in terms of the processing of grants and so on, and also to ensure that we implement the ICT system so that we have a central database and we are more efficient in terms of, simple things as if somebody is on a grant and they want to move from one location to another location, and not having to disrupt their transfer. And that's done. So I think treating for short term, I would say treating with the standard operating procedures so that people are also getting their grants processed in a shorter space of time, treating with our customer service issues in the various offices, dealing with that so that people could have a sense of where their application has reached and whether it is approved and those sorts of issues, and also the staffing. The recruitment drive, ensuring that we bring on board a significant number of our members of staff so that we can deliver. In terms of the medium term, I think the whole issue of bringing on board, implementing the National Social Mitigation Plan, and treating with the resilience of the population, especially in the light of what has taken place with the oil prices and so on. Our citizens must be more resilient, even in the area of the youth and how they treat with their issues, Lots of young people not treating very well with the issues that face them, whether they, thinking about suicide and so on, but helping people to cope, and that's what resilience is all about. So in the medium term, I think it's important for us to ensure that our programs are treating with that, and also the developmental aspect of our programs that will ensure that people are graduating out of receiving a grant. And in the long term, our fourth strategic objective, which is an organization that is innovative and flexible and meeting the needs of the people on a timely basis, but more than that, understanding how we are impacting, which is Member Dionarine's, major area of concern, and ours too, so that we have in place a framework that is actually measuring what we do.
And Mr. Cannon is your name? Cannon. Just to ensure that we didn't make you feel that you came here for no good reason, I just want to ask, in terms of what we've been told before about is SEMS, and that negotiations are going to begin soon. Are you in a position to say who's the vendor? Who's going to supply?
Not at this
At
time.
this point, as we don't know any negotiations, what may take place.
Okay, so may I ask then, with whom you're negotiating?
We are negotiating with a particular supplier.
Okay,
yes.
all right, so
Through
until those
iGov
negotiations,
Through
okay, good.
iGov TT,
Fine, I
yes,
understand.
yes.
Okay, so thank you very much.
And Chair, if I may, the Permanent Secretary has some closing remarks.
Oh, well, I was about to ask you if you read lips, because I was going to ask you PS, but if you defer to the Acting Permanent Secretary, sure. Ms. Tran.
Okay, on behalf of my colleagues, I'd like to thank the committee for inviting us here and allowing them to engage in such vibrant discussions on the activities of our ministry. We do look forward to any recommendations which you all may have to allow us to improve service delivery to our clients who are the most vulnerable in society.
Thank you very much. And I just want to ask one thing, like I just do on this discussion to end. What can you recommend that we can do to assist you?
Send your recommendations. Yes, because we have had, as PS said, rich discussions, and there are a number of areas that you have put forward that, we feel that we can take on board and change some of what we do.
Okay, so thank you very much. So I want to thank you, Madam PS, Acting PS, Deputy PS, Deputy PS, Management, Information Technology, and Auditor too, for coming and spending such a long time with us, letting us understand what you do and how you get it done and the constraints that you suffer under and your plans to improve your service delivery. I want to wish you all a very safe journey home. There are some other questions we have here that we'll send in writing with a time frame. I want to thank the members of the media who attended the session. I want to thank the members of the listening and viewing public who've stayed with us, sent in questions, and we know you're out there viewing with interest because you meet us at places and ask us further questions. So I want to thank you all. This meeting is now suspended.